Okay, tuberculin skin testing thresholds are really commonly tested on USMLE both Step 1 and Step 2. The TST, or the tuberculin skin test, will be considered positive depending on the induration size and the patient population that is being tested. Let's start with the induration size of 5 or more millimeters. This is positive if the individual has an HIV infection, if they had recent contact with a patient with known TB, if a person has nodular or fibrotic changes on chest x-ray consistent with previously healed TB, or if the patient is an organ transplant recipient or other immunosuppressed people. Now let's go to if the induration is 10 millimeters or more. This is considered positive if the patient is a recent immigrant, which means less than 5 years ago they came into the country from a TB endemic area. The next is injection drug users. The next are residents and employees in very high-risk settings, such as prisons, nursing homes, hospitals, and homeless shelters. A new one is mycobacteriology laboratory personnel. The next is people with conditions that result in higher risk for TB activation. This includes people with diabetes, with leukemia, end-stage renal disease, chronic malabsorption syndromes, and low body weight. This also includes children less than 5 years old or children who have been exposed to adults in high risk category. The last one is the easiest. If the induration is 50 millimeters or more, it is considered positive in all healthy people. Remember, as far as treatment, is if the patients have no signs or symptoms of active tuberculosis, the treatment will consist of rifamycin-based regimen. This means rifampicin plus isoniazid weekly for about 3 months, or 9 months of daily isoniazid plus pyridoxine is generally a curative treatment.